Hi, hello friends, welcome back to our channel. So after this NEETPG, we are getting multiple queries regarding how about medicine as a post-graduation degree in general, and what and all aspects you should see in a college before joining medicine, and how about the functioning of a normal medicine department in a college in general. Okay, so all these I thought of sharing it to you in a animated fashion. Let's start it. So in your medicine PG, you will be exposed to first the OPDs and emergencies. Then the patients will be shifted to wards where you will be managing them. Then you will be having ICU postings in between. So first let's see how does a medicine emergency function, because this is the platform where the patients are initially assessed, and then your everything for the patient, your initial evaluation, assessment and thinking process, everything starts from this point. And from this point the patient will be shifted to ward, and then step by step diagnosis and management will change each day, and finally you will be coming to a conclusion, and then you will be discharging the patients. So first let's see about emergencies. First, if you see in any hospital, if you see, there will be a casualty where all sorts of emergencies will come. There the casualty medical officer will be there along with some JRs and interns. They will actually initially resuscitate the patients, and they will be trying to segregate those patients whether they should go to surgery emergency or medicine emergency or orthopedic emergency or gynecological emergency, whatever emergency as it indicated. Yeah. Once our patient comes to the medicine M, what are we going to do? First, the interns on duty, they'll be measuring the vitals of the patient like blood pressure, sugar levels, saturation, and they'll be informing to the PGs. Depending on the number of patients reaching the M at that particular time, the PGs will start prioritizing what patient to be seen first by seeing their initial assessment. Okay, they will be the history, a short history will be written from the casualty itself. So we'll be seeing the history and their vitals, and depending on their clinical status, we'll be prioritizing which patient to be seen first, and those patients will be attended first. So next is regarding the emergency procedures, like those patients who need immediate resuscitation like intubation, CPCR, those patients will be given highest priority, and those patients will be done intubation and CPCR as soon as possible. These are life-saving procedures which are must-to-know procedures before completing your first year of post-graduation. So within first 2-3 months you will be exposed to lots of intubation and CPCR. At the end of first 3 months, 4 months, you will be really expert in intubating patients. Okay, next comes those patients who are relatively stable. These patients, if you see, the PGs will be taking a detailed history, and with the clinical vitals of the patient and on examination findings of the patient, we will be trying to make an initial impression what he might be having at this point of time. Then depending on the initial impression which we have made, we will be advising investigations for the patient. Like take a MI patient, we will be advising troponins and cardiac enzymes, CPKMB, all those. If it is a COPD patient, we will be advising ABG, chest X-ray, all those. So it depends on the clinical status and your initial impression after seeing the patient. So it will be ordered, and those sampling will be done by the interns on duty. Okay, yeah. So next is, this same patients will be reassessed by the senior PGs and senior residents. They will try to refine your impression as well as treatment. So yes, so at this point of time you will have a relatively an idea of what the disease might be. Also, it is the work of first year PGs to ensure all the radiological investigations, blood investigations which are to be done for those patients, so that we don't delay in decision making for advising for discharge or admission. So those will be under your work list. So basically sampling will be done by the interns, and all the procedures like Riles tube insertion and Foley's insertion, cannula insertions, mostly they will be done by the interns. Okay, yeah. And ABGs, for initially you will be teaching the interns how to do, then slowly the interns will start doing ABGs too. Yeah. Next, if you see, there comes the part of workup. These patients in an emergency, they will be admitted and they will be sent to the wards, and in the wards we will start the workup for those patients, and day by day it will be progressing, diagnosis part. Then if you see the procedures which you should know, must know in case of dealing with medicine emergencies, what are the procedures you will be doing? First is this, yeah, it's a pleural tap. So pleural tapping, if you see, mostly we'll be doing to confirm. Diagnostic tap we'll be doing, and therapeutic tap if indicated. Okay, and at the same time ICD insertions like intercostal tube drainage in case of some pneumothorax or hemothorax, pyothorax, all those things, there if such indications exist, in some colleges it is done by medicine residents, and in some colleges it is sent to surgery department where they insert intercostal tube. Okay, yeah. So from the pleural fluid analysis which you send in the emergency, those reports also you should collect at the end, within the end of that emergency, because that will help in deciding. Many decision making are based on those reports also. So those fluid analysis like cell counts, this sugar, protein, LDH values, all those depends. All those determine your clinical diagnosis also, and help in your decision making. Yeah. Next comes your paracentesis, ascitic tapping. So here also it can be done as a diagnostic tap as well as a therapeutic tap. Diagnostic, where you are unsure of the diagnosis and you are doing it to confirm the diagnosis, as well as in case of chronic liver disease patient who is developing spontaneous bacterial peritonitis signs, SBP. So to rule out SBP, you are doing this tap. If you find the patient is having only abdominal pain, and if you find those symptoms, if you find the patient might have the symptoms of SBP, but in ascitic fluid turns out to be normal, just you can treat medically and you can discharge the patient. So many clinical decision making also depends on these fluid analysis reports also. Next comes your lumbar puncture. In every emergency, you will be getting minimum some 3 to 4 altered sensorium patients, minimum you will be getting. So among those altered sensorium, you will be clinically assessing those patients, and those patients who you think need a CSF tap or a lumbar puncture, you will be doing in the emergency itself. Same thing, same cell counts and sugar protein value, and in CSF we will be sending those ADA, adenosine deaminase, to check for whether tuberculosis malignancies, and those extra CSF will be taken and keeping, so that we'll be sending it to further investigations later on. So yeah, next comes the central venous catheter insertion. So this is actually a vital procedure which is done in the emergency, which is actually life-saving in many patients. If you see those volume overloaded patients like cardiac, renal or hepatic disease, where the patients are volume overloaded, but still the patient needs fluid resuscitation too at one side due to some fluid loss going on in the other side, and or fluid in the patients who are in an extreme state of fluid deficit, or where you want extensive potassium to be replaced, high degrees of potassium to be replaced for those patients, there you will be needing a central line. So learning this procedure is also really helpful for you as well as the patient in the long term. Okay, yeah. Next is the radiological investigations in emergencies. So initially mostly all the patients will be assessed, and they will be sent to do a chest x-ray or a ultrasound of specified portion like hepatobiliary system or kidney urinary bladder, any segment, or NCCT head. We'll be sending those patients to emergencies to do those procedures. And at the end of emergency, if you see, as a first year, it's our job to collect. So as a first year, it will be a job to collect all the reports of those patients and radio, and you should have made those patients do those radiological investigations. So with all the reports, we'll be able to come to a conclusion what diagnosis might be going on in this patient, and whether you can cross check whether you what initial impression you made, whether it's right or not. Then also it will help you to give a further clue to some other condition going on in this patient. So all these are just puzzles. Like each investigations or each clinical finding is just like a puzzle where you'll be jumping one by one, and the diagnosis will be coming to you at the end of everything. Okay, yeah. Next, if you see, after admission, these patients will be sent to wards. So their wards, coming to medicine wards, if you see, their daily vitals will be happening for the patients both morning as well as evening, and vitals chart will be sticked on the bedside of each patient. Actually, ward portion will be a interesting segment actually in terms of medicine, where we'll be assessing each patient, and in the post emergency we'll be advising lots of investigations to be done to come to a concrete diagnosis. Okay, so as you know, diagnosis making is really the interesting part in medicine. So for that, we'll be trying to do each one investigation by the other with some rationalization before doing those investigations. Okay, and you will be making lots of differentials before sending those investigations. You shouldn't depend maximum at this segment of your PG life. Here it is like patient is there by your bedside. It's your role to think daily of what and all diagnosis can be made for the patient, what and all differentials can you think for those patient, and how and all you can work up for the patient. No one will scare you or threaten you if you do some extra investigations. No, everything is happening in the hospital itself. So you can order some investigations which you think if it will make some change in the diagnosis. Okay, so it will be actually this round segments, and the ward segment will be an interesting part where the patients will be extensively worked up, like peripheral, from starting from anemia workup. Like anemia workup will do each investigations like peripheral smear, B12, folate, retic count, and all the anemia workups will be doing. Then the bone marrow biopsy as well as bone marrow aspirate, these things also is done by medicine PGs only. So initially we might take help from pathology PGs for that, but as time goes on, we'll start doing bone marrow aspirate and bone marrow biopsy by ourselves. Okay, so yes, that's also one of the procedure which you'll be learning. Next, if you see, all the next comes those extra investigations like autoimmune profile, ANA, anti-dsDNA, OSSB antibodies, all those. Okay, then echocardiography. In some colleges, if you see, super specialty hospitals will be attached by that hospital itself. So we'll be sending those patients to their hospital itself. Some in colleges it will be associated hospitals, super specialty hospitals. So there we'll be sending the patient to get echo done, and the patient will come back to our wards. Biopsies, all biopsies like imaging guided biopsies, like ultrasound guided kidney biopsy, liver biopsies, and CT guided lung biopsies, adrenal biopsies. All those will be happening, and majorly it will be guided by the radiologist mainly, and we will be assisting them. Okay. And after coming to what's the radiological investigations which the patient might need in extra, might be those contrast CTs, CCT of the brain, all the body parts like lungs, CCT of the lungs, brain, paranasal sinuses, or abdomen, pelvis, and also MRIs will be happening, and all like mammograms, and renal artery Dopplers, ultrasound Dopplers will be happening, like renal artery Doppler, splenic axis Doppler, upper limb, lower limb artery Dopplers. This will be happening. Then ultrasound whole abdomen, ultrasound pelvis will be happening. PET CT will at the end of the spectrum, PET CT scan. Yeah. Next, for depending on the number of units, you will be doing emergencies too. For example, if there are 6 units in a college, then each day 1 unit will be seeing the OPD, and that unit will be doing the emergency. For Sunday duty, if you see, it will be rotated with each unit coming one by one. So actually, if you see, at after some 1.5 months, you will be having one double emergency. Okay, it will be really hectic. Ending on with this note of how the life of medicine PG, how the week of the medicine PG starts and how it ends. So initially in the emergency, you will be continuously seeing patients, you will be ordering investigations, you will be ensuring investigations. So as a first year PG, you will be exposed to lots of patients first of all. Then you will be assessing those patients, and you will be ordering investigations which you should ensure whether they have come or not. Then you should also make the interns do some sampling, do some procedures like RT, Foley's, all those procedures. So all these must be ensured by you people. Then if you see, so at this stage of emergency and post-emergency, and the post-emergency, your workload will be even more increased, because that stage, all the consultants and the senior residents and PGs, they will give additional workup, what and all to be done. So that day also, after doing emergency, you will be relatively tired. Okay, so those are days which you will be feeling really tired, but note my point, those 2 days might be hectic, but following days if you see, the way how a patient is approached from the emergency and till his diagnosis, many wonderful and interesting diagnoses turn out at the end of the day. Okay, so by seeing those, it will be like a satisfactory thing at the end of the day, and also you will feel satisfaction for taking this post-graduation. So many patients, if you see, they'll be starting with some different complications, different presentations. They'll be ending in some rare clinical diagnosis, rare clinical syndromes, and those patients, some patients will be managed excellently, and they will be discharged from your wards. So those will give you immense pleasure and will give you intense satisfaction also for taking this post-graduation. And at the end of this emergency and end of this week, you will be feeling relatively free. And the pre-emergency, where at the time where the PGs used to freshen up themselves. Okay, yes. Then comes the normal academics which are in medical colleges. If you see, normally we'll be asked to do a thesis for your post-graduation degree, which will be discussed with your guides, and it will be carried out, and that will also be running simultaneously along with your this ward work and emergency works. Then if you see, staff rounds will be conducted, where some interesting patients would have come to your ward. They might have presented with some rare presentations, and at the end of the workup, you might have diagnosed some rare interesting case. So those patients will be presenting there in the staff rounds. So and everyone will be discussing about what and all could have been done, and what you have done had clinched the diagnosis, and what management you have done extremely well, and what you could have done. So all these discussions will be, healthy discussions will be happening there. Then if you see one more meet, which is the mortality meet, where the mortality issues will be discussed, and we'll be discussing why the patient has expired and what all could have been done to save this patient, and what went wrong with this patient. All those we'll be discussing. Okay, yeah, so these meets will be happening side by side, and case presentations and those discussions will also be happening side by side. So at the end, if you see, it's a combo meal pack where you'll be offered everything, each and everything, but really want to solve these kind of puzzles, and if you think these will give you extreme satisfaction, you must definitely choose this field. Okay, then before choosing medicine in a college, you can ask of all these emergency procedures, how much procedures are available, how much facilities are available for these procedures, and how is the hands-on there. All these things you can ask, and what are the possible investigations that are happening in the hospital. All this you can ask, and this is what will make, and most importantly, the caseload. These are the things which will really make you which will actually improve your knowledge. So just see these parameters apart from seeing only teaching academics. Okay, these stuffs will make your clinical skills improve a lot. Okay, so focus on these things, these areas where you get an adequate exposure or not with the emergency procedures or emergency exposure and patient caseload exposure. All these you see. That's it for the day. Hope it helped. So if you have any doubts, you can drop it in our comment section, and subscribe to our channel for further videos like this. Thank you.